All right, so now I'm going to assess the posterior chest. Could you turn to your side, please? So I'm going to continue with the skin inspection. Upon inspection, I don't see any signs of any masses. I don't see any lesions. The skin is intact, and I don't see any rashes or bruises. So now I'm going to assess for any masses or tenderness. Okay, good. I don't feel any masses or any tenderness. So now I'm going to assess the symmetry of the of your lung expansion. So I'm going to place my hands here on your back, and can you take a deep breath for me? Good. So lungs are expanding evenly. So now I'm going to assess for tactile fremitus. So I want to place my hands here. Can you say 99?
99.
Again?
99.
One more time?
99.
Good. So there's even tone and vibration here. So now I'm going to percuss the lung fields. And we're going to do the sides. And then while I'm here, I'm going to assess for any tenderness of the kidneys. Okay, good. So no tenderness. And then now I'm going to listen for breath sounds. Can you take a deep breath? Again. 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 And last time. Good. And breath sounds are clear. All right, so now I'm going to assess the anterior chest. Continuing the skin inspection, looking at the skin, I don't see any lesions, any lacerations. I don't see any obvious masses. So the skin looks nice and intact. Now I'm going to palpate for any tenderness or any masses. So. All right, I don't feel any masses and there's no tenderness. Also, now we're going to percuss. Okay, that sounds good. And then lastly, we will auscultate to listen to breath sounds. All right, take a deep breath. Again. 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 The side here. Deep breath. Good. And last one. Good. So lungs sound nice and clear. All right, so now I'm going to assess your upper extremities. Continuing with the skin inspection. Your skin looks good and intact. I don't see any lesions, lacerations. I don't see any wounds, rashes, or bruises, so that looks good. I'm going to palpate for the temperature of your skin. Good, the skin feels nice and warm. The texture is smooth and it's nice and dry. And then your hair pattern is even on both arms. Now I'm going to palpate your arteries. So your pulses. So starting with the brachial pulse. Good. And now the radial pulse. Good. And ulnar pulse. Good. And then we're going to do the same thing on the other arm. So brachial. Radial. And then ulnar. Good. So your pulses are nice and strong and equal on both sides. So now we are going to assess your strength and range of motion. So starting with your strength, I want you to squeeze my hands. Good. That was even between both hands. So now if you could stick your arms out in front of you, I want you to push up against my hands. Good. And then push down. Good. Now we're going to assess here. So push back against my hand and push forward. Then we're going to do the same thing on this hand. Push back, forward. Good. Good strength on your arms, your upper arms and your forearm. And then now for your range of motion, can you extend your arms for me onto your sides? Good. And then raise them above your head and clap. Good. And then behind your head. Good. And then reach back to your low back. Good. So good range of motion there for your shoulders and your arms. Okay, so now we are going to assess your heart. Upon inspection, everything appears to be symmetrical. I don't see any lesions or any scars that would indicate any past surgeries. So now if I could just have you lean forward, and we're going to listen to the bases of your heart to assess for murmurs. So using the diaphragm, breathe out. Okay, and then again. Okay, good. I don't hear any murmurs there. So now if I could have you lean back, and we're gonna put your feet up here. Okay. So now we're going to assess for jugular vein distension. So if you could just look to your left, please. And there doesn't appear to be any jugular vein distension, which is good. There's no indication of any fluid overload. Now, if I can have you lean back just a bit more. Good. And now we are going to listen to your heart sounds. So starting using the diaphragm, I'm going to listen to your aortic valve. Good. And now the pulmonic valve. And now the tricuspid. And then the mitral. Good. And then we're going to do the same thing using the bell. Tricuspid, and then mitral, okay, good. All right, so now I'm going to assess your apical pulse. So I'll start by listening to it to assess the rhythm. So I'm going to listen to one full minute. We're using the diaphragm here. Okay, good. So your apical pulse is at 65 beats per minute. And then now we are going to palpate the apical pulse to assess for any thrills. Good. And I don't feel any thrills. And then now I'm going to have you turn to your side. Turn a little more. There you go. All right, and then we're going to listen one more time. This is where we're listening for any S3 or S4 sounds at that apical pulse again, using the bell of the diaphragm. The bell of the stethoscope. And I don't hear anything there. And then while you're turned here, we're going to assess the skin again. So looking specifically at the sacral area, just looking for any pressure injuries, and everything looks nice and clear there. So that will complete the heart. All right, so now we are going to inspect the abdomen. First, we're going to look for any distension, any scars, lesions, bruises, none of which I see. So that looks good. Now we are going to auscultate for bowel sounds. So I'm going to start in the right lower quadrant using the diaphragm. And then okay, good. So bowel sounds are present, which is good. So now we're going to listen for any bruits. So using the bell of the stethoscope, we'll start right here for the aorta. Okay. And then we'll go over to the left renal artery. And then the right. And then we'll find the umbilicus and we'll go over to the right iliac, the left iliac. And then the right. Good. And then we'll come down to the femoral area and we'll do the left femoral artery and then the right. Okay, good. And there's no bruise, so now we're going to percuss the abdomen. So same like we did before. And then last, we will palpate. I'll start with light palpation first. So, and here we're still assessing for tenderness and any masses. And then I'm going to do a deeper palpation, assessing for tenderness. Okay, good. And there's no tenderness, so that will complete the abdomen assessment. Okay, so now we're going to assess your lower extremities. Looking at them, skin tone is even. I don't see any evidence of any lesions, lacerations, no masses, and I also don't see any evidence of any swelling or any edema. All right, so now I'm going to have you lay back for me. Okay, and we auscultated the femoral pulse, but now we're going to palpate it. So I'm gonna palpate here. Good. And then on the other side. Good. Now we'll do the popliteal. Good. And then on this side. Okay. And then we'll do the posterior tibial. And then the dorsalis pedis. Okay, good. And now we will assess your range of motion. So what I want you to do first is bring your knees to your chest. Good. Extend them. Can you lift this leg up? Good. This leg. Good. All right. Can you lift this leg up and move it side to side? And now this leg. Good. All right. Now we're going to assess your strength for your upper leg. So push against my hand. Good. Push down. Good. Same thing over here. And one more time. Good. Alrighty. And then can you sit up for me? Good. And you have good core strength there. So now we're going to do the strength for your lower legs. So push against my hand. Good. Pull. And same thing over here. Push. And then pull. Good. All right. So now we are going to assess your feet. So feet look clean, good. Looking between each toe, skin is intact. I don't see any wounds there. And then the capillary refill for each toe is also good. So everything looks good, and I will complete the assessment of the lower extremities. Okay, so now we're going to assess your neurological system. So first, I want you to close your eyes, and I want you to tell me, we're testing your sensations, so tell me what you feel, okay?
Something funny. Something soft. Something soft. Something funny. Something funny. Something soft. Something soft. Something funny. Something funny. Something soft.
Okay, good. All right, so your sensation is good. You can open your eyes. So now we are going to assess your sense of position. So actually close your eyes one more time, and I'm going to hold your finger, and I want you to tell me which direction it's pointing, okay?
Up, down, right, left.
Good. All right, so now you can open your eyes. All right, so now we are going to assess your stereognosis. So I'm going to put an object in your hand, and I want you to tell me what it is, okay? So close your eyes one more time. And open your hand, and tell me what that is.
Okay.
Good job. All right, so you can open your eyes now. So now I'm going to assess your cerebellar function. So I want you to touch my finger and touch your nose, okay? Fast.
Oh.
Good.
Oh.
All right, and now we're going to assess the function for your lower extremities. So I want you to take the heel of one foot, and rub it down the shin of the other. Okay, and do the same thing with the other leg. Good. All right, and then now I'm going to assess your deep tendon reflexes. So I'll start with the triceps. Let me see the arm here. Okay, and then we'll do your bicep. I'll place a finger here. Okay, and then we'll do your brachial radial. We'll lift your arm up here. Okay, and then let your legs hang. Your okay, and then we'll do the Achilles. Okay, and then now we're going to do the same thing over here on the other side. So bend your arm, tricep, bicep, brachial radial. Okay, and then we'll do the patellar. Let your legs swing. There we go. And then Achilles. Okay, good. And that completes the neurologic assessment. All right, so now we're going to assess your musculoskeletal system. So I want you to walk down normally, your normal walk. Good. Turn back and walk this way. Good. Now I want you to walk heel to toe. Good. And then walking back, I want you to walk on your toes. Good. And then coming back this way, I want you to walk on your heels. Good. All right, you can head back that way. So you can stand right here, actually. All right, so now I'm going to assess for Romberg sign. So I want you to close your eyes and just stand still. And here we're just looking to see if you have any difficulty maintaining your posture. Okay, good. So now I want you to, we're going to assess your knees here. So if you need to hold on here, you can hold on to me. Just do a shallow knee bend. So just good. And then the other leg. Good. All right. And then now we are going to assess your spine. So if you could turn around for me. Turn. Okay. So here we're going to just palpate the vertebral column for any masses or anything. I don't feel anything there. We'll assess your range of motion. So can you turn, lean side to side, like bend side to side. Good. And then if you could lean forward for me, as far as you can go. Good. All right. And so we're just assessing the spine for any abnormalities or any curvatures, and everything looks good there. Your spine is nice and straight. You can stand back. All right. And that concludes our assessment. Thank you for your time.